been using platelet-rich plasma for about 6 years, and Dr. Banno and Dr. Ripoll also have lots of experience. We're all in different parts of the country, but we collaborate and work together quite closely, in fact. So let's talk a little bit about the market. The market is very exciting, actually, and there's some new data that shows that PRP is going to go from a $160 million industry to $452 million in 2024. And so that's very exciting for all of us entrepreneurs, of course. But what's most exciting, because we are physicians first, is that this technology works incredibly well for lots of different modalities and different challenges, and so we can talk a bit about that. But I mean, you know, what's better than something that works? It's a regenerative therapy, so it's from the patient to the patient, and it's growing and is quite profitable. So that's sort of the perfect storm. And you know, as physicians, we have a rough time in business quite frequently. In 2011, more physicians filed bankruptcy than any other time in history. And so, you know, insurance reimbursements are changing. It's a very difficult climate out there. I'm very happy to be doing PRP now for a while because it's, you know, it saved my business, to be perfectly honest with you. There are a lot of Americans who are looking for platelet-rich plasma. They're certainly looking for anti-aging types of interventions, joint pain, hair regrowth. They're looking at dietary supplementation. So the whole functional and regenerative approach is very hot right now, as it should be. It's a wonderful way of caring for patients and a great way for the patient to get what they need. The public spends $70 billion annually on medicines for age-related diseases, so they're certainly willing to spend money, and they're looking for results and different modalities. So for these patients seeking functional and regenerative approaches, we have the birth of platelet-rich plasma in the marketplace. And really we're helping as leaders of this paradigm shift from a disease management approach to a more prevention and wellness approach. And then certainly PRP is intervening and is a remarkable medical intervention when there is a problem. So it's not just a prevention type of a problem, it's a true intervention. And what we are trying to do as a group is to help you with this opportunity and to share with you our experience and our vision and the ways in which we grow our practices. You know, what works for me may not work for you. What Dr. Ripoll does may really sing to you, and Dr. Banno has certainly been very successful. So the variety of us, we use PRP for different modalities. I use it for female as well as male sexual dysfunction, for urinary incontinence, certainly joint pain and muscle pain, for aesthetics, to regrow hair. So in 2012, I started using platelet-rich plasma for aesthetics, really. I didn't add the sexual medicine until 2011, and that was after I was doing aesthetics for several years. Adding platelet-rich plasma changed the game for me. It was pretty awesome. My patients that I'd been using Botox and fillers in, who had been quite happy, were now even happier because of the benefit that the PRP lended itself to with rejuvenating the skin. So I think about Botox relaxes the muscles, the filler creates the shape, this PRP rejuvenates the skin and creates a real youthful glow, if you will. So my patients stood up and took notice, and they were requesting rather, that I use PRP. And so after watching what was happening with this skin for about a year, I thought, this could work from a sexual medicine perspective. And so I got some training, and off to the races we were, because it really does work very, very well. So I added the hair regrowth procedure, and you know, none of these procedures are going to be a magic wand. I just want to say that really early on. Platelet-rich plasma is a tool. We're all professionals. We all have lots of tools in our toolbox. And so, you know, to think that we can just solve every problem with platelet-rich plasma is not true. However, we can solve a lot of problems, and we can certainly use PRP as a very effective tool. And so, you know, I think it's important just to point out, again, this is just an honest conversation. We'll certainly share our ups and our downs with you should you wish to ask any questions. So in 2011, very early on, I started training physicians to do these procedures, and that's been wonderful because I've met hundreds of doctors, and we all continue, many of us continue to communicate and help each other through some of this. I did the stem cell fellowship through the A4M. I did some other stem cell training through I think it was RegenaStem. They've changed their name a few times. And I haven't gone there. I really haven't embraced the stem cell part of this normal, what would seem a normal progression yet. It's something that is very labor intensive. There's not a lot of data that supports it yet, so I'm a little slow to the game. With PRP, it's a very simple blood draw. It's very simple for the patient, and I'm getting some nice results. So certainly not crossing stem cell off the list by any means, but you know, I'm not there yet, and I've been in this for quite a while. In 2015, we co-published a very small study for it was actually for female sexual dysfunction. It wasn't for ED, and that was with Dr. Runnels. And then Dr. Banno presented a paper in 2016, this 2017 already, in 2016 at the SMSNA, and that was looking at erectile dysfunction, and I'm sure he'll be happy to tell you a little bit about that. I published a book that we really haven't even fully introduced yet, and it's called Regenerating Sexual Potential, and it really is all about all of the different modalities that are available to men and women, and including platelet-rich plasma. And you know, it's a good book in that regard, that it helps to show you the place that platelet-rich plasma really has in the sexual medicine world. And then in 2015, I really co-founded PRP Network, and that's primarily a training, marketing, and research company where we are working collaboratively together for the best outcome.
So I've been in this practice of sexual dysfunction for a long time. In 1992, I started the Sexual Health and Treatment Center of Illinois with a psychologist and a psychiatrist, and we formed a great bond. And over the years, in my little area of central Illinois, I'm erectile dysfunction. I have patients and physicians, even competing physicians, send me their patients. In 1996, we developed a mobile surgery center that was has been used worldwide now. And my ambulatory surgery center that I have on campus also allows me to do minimal invasive penile implant procedures, which are around 15 to 20 minutes. So when I met Dr. Roy, I had been reading about platelet-rich plasma and stem cells, and I thought this fit very well into my practice. And so, you know, I look at it that sexual dysfunction, especially erectile dysfunction, is my special expertise, and I can take them from all the way to, you know, talking to patients, to pills, to injections, to vacuum devices, to platelet-rich plasma, and if need be, penile implants. So I try to do it all, and since I've been dealing with urinary incontinence for over 30 years, the O-shot has been tremendous for me. I think I'm looking at 90% success rate with the overall result of the O-shot. And so for mild urinary incontinence, overactive bladder, people who don't want to be on any of the pills and medications that kind of make their mouth dry or they have constipation, a great alternative. I had 3 women come in to see me today and follow up, and they ranged from age from 32 to 62, and they were all very happy. 2 of them had incontinence, and they were cured of their incontinence, and one was a strictly sexual problem, inability to reach an orgasm for years, and now she's having an orgasm, and she's very happy.
You know, I started on this journey of trying to use alternative ways of helping women with incontinence and children with ureteral reflux years ago. In 1990, when I was a resident at Baylor, we started experimenting with collagen. And we started, you know, trying to do it in the lab, and we played around with cross-linking, and then we did it from pigs and all kinds of animals. And so I always had a little bit of, you know, nervousness about using something that was not made from your own body, and you never knew about the sources. And also the other thing that was difficult was trying to find the right cross-linking, because even though it was a great bulking agent, it did nothing for rejuvenating the tissue. It did nothing in providing new blood vessels and in creating a setup that would have future, meaning that things would get better with time, instead of the collagens, which, you know, if we were lucky, if it didn't get broken down in about 3 months. So realistically, what I love about PRP, and I think Dr. Roy mentioned it, is that we know in our hearts that we're doing something that there's no harm. I have never seen a complication, maybe a little bruise here and there, but I've never seen a complication. The other beauty is we know we're not putting anything artificial. So that to me is very comforting. Primarily when for years, you know, treating women who were beyond the usual ways of treating urinary incontinence and had to undergo surgery, and using those meshes, which now we know where, you know, down the road can cause a lot of damage. And so putting something or doing a technique that you know has great results and that has no complications is just really helped me sleep better at night. The other thing that I really liked, and you know, kind of when I went and was lucky enough to meet Dr. Roy and Dr. Nichols and other people like that, Dr. Reynolds, and then so fortunate to find Dr. Banno as well. And, you know, sharing how can we take these to the next level? You know, it's great. We know that it helps with this, that, and the other. And it always amazes me, and I just love Dr. Roy, because if she can reach it with a needle, you can bet your life she's going to inject it. I mean, she's fearless. Great courage and great technique. So I love working with her, because sometimes I'll call her and say, hey, what do you think about this? She goes, go for it. and it's been fantastic. So one of the things, going back to the people that have had problems with meshes, these are very difficult people to deal with. It's difficult women. They're usually a little bit elderly. Their tissues in the vagina are very thin, which is one of the reasons why we get the erosions. You try the usual things with hormone creams. Some of them will close, but a lot of them don't. Surgically, we try to remove them, which is a nightmare after all those years of being there. And so I started getting courageous and saying, well, I don't know what else to do for these people. So I started injecting all these vaginal erosions that wouldn't heal with PRP. And to my surprise, 9 out of 10 of these women, all of a sudden the tissue would regenerate, the mesh would go away, and fortunately the thickening of the vagina would, you know, the tissues were great. So it was godsend. And slowly from that I started using it in other areas of my practice. And then about 2012, I started using it out of desperation on my women with chronic pain. I mean, I was the first woman urologist in Colorado, and I would inherit every poor woman who had pelvic pain, as far as, you know, related to the bladder, related to intercourse. And for the longest times, we all know as physicians, they're very difficult people to take care of because we haven't had the right tools to help them with. So PRP has added in my practice an incredible tool to help a lot of these poor women who don't have a life, who either go to the bathroom every half hour or an hour during the day and night, whose pain is so significant they're not able to be intimate in their relationships at home and with their partners. So it has been incredibly effective in women that had failed everything.
We'll take the O shot. If I'm charging the patient $16.50, I'm purchasing the PRP kit. I'm also purchasing the Apex or the Intensity. So my gross profit is $1,200. And that is not bad at all. I don't know about you, but you know, I have to work pretty hard for $1,200. And to do an O shot and to you know, do the consultation with with a woman and feel like I really have something to help her is not only rewarding from a spiritual perspective and a professional perspective, but also from a gross profit perspective. It takes minutes really to do the injection. It takes less than 10 minutes to actually create the platelet-rich plasma. My staff participates, so my part of that time is really pretty short. So the return on investment here is significant. I mean, really you need to do 4 procedures, 5 procedures to completely recover your cost, and then you're going on to add to your bottom line, which is very important as physicians. I mean, we have businesses that we're running, and so there's no shame in taking people's money for procedures and that actually work, right? That's a beautiful thing.